Initial assessment of the trauma patient. Everybody needs to know what to do in a case of emergency. If you are walking in the street and you see an unconscious person in the floor, don't panic. Come close to the person and ask if he is alright. Make sure you speak loud and clear. If he doesn't respond, call 911.
When the person realizes the call, this arrives to the base. Then the radio operator sends authorized personnel to the ambulance to respond to the call. The time that the personnel gets closer to the accident or the person that needs help is going to determine different ways to help them or he. They are: is the extraction vehicle required? Determine the injury mechanism. Determine the number of the patients. Is additional help required? This is by the time the paramedics arrive, they work more easier and more effective. But on top of that, personal safety is first. When you get closer to the patient, you make a quick evaluation. You are going to take the vital signs and the sample. Number 1. Head-neck evaluation to determine if the patient have any wound in the head or cervical damage. Evaluation of the pelvis and abdomen. It needs to evaluate if there is any fracture or if the abdomen is unstable. Number 3. Limb evaluation. After you have been determining the important, you're going to the head, the legs, and the arms. Number 4. Post-evaluation.
Essential equipment: insulation of body substances, airway equipment, first aid kit.
Get information about the scene. You will analyze to the patient to determine visible problems. Patient response level. You are going to talk to the patient. If he doesn't respond, makes a painful stimulus. Main complaint. You will determine what can make the patient worse.
Make a gentle open. Upon arrival, you will calmly announce that you are arrived if the patient is conscious. Obtain information. If the patient does not respond, begin an initial evaluation and treatment. You should always evaluate. Mental state, Glasgow scale, airway. It will be very important to always evaluate the airway. Breathing. If the patient has any difficulty or is fine. Circulation. If there is any bleeding, control it.
All these evaluations should not take more than 2 minutes.
Inside the ambulance, apart from performing that treatment so that the patient improves or does not get worse, you will evaluate your vital signs. If it is not serious, you will reevaluate it every 15 minutes. If it is serious, every 5 minutes.
The ambulance will arrive at the emergency room, and triage will be performed to determine the severity of the patient.